Arthur Gonzalez, the CEO of Denver Health Medical Center, announced his retirement this week. The news comes on the heels of the resignations of 3 of the hospital's 5 neurosurgeons and other complaints about his leadership over the last 4 years. Ben, 4 years is a pretty short tenure. Obviously, a lot of tumultuous news coming out of Denver Medical Center. What's your take on the retirement news?
Well, retirement is a kind term, I would say. You know, the neurosurgeons resigned, the ICU nurses have complained. 4 years may seem like a brief amount of time, but it's plenty of time to do a lot of damage. You know, generally speaking, the staff there has been upset because the focus on patient care and cleanliness has really gone down. I mean, there's no other way to put it. And, you know, last week, the ICU nurses finally voiced their displeasure to the Health Authority Board, and now we have this action. It's very nice that the gentleman is calling it a retirement. You know, I would point out that this is the 3rd consecutive post that Mr. Gonzalez is leaving under not very good circumstances. So frankly, this does not come as a surprise. I think that the decision to hire him 4 years ago was misguided. The mayor of Denver, once again, is completely silent, even though he is totally responsible for this.
Now go into that because it's not named by the mayor. So.
It's not, and so the way to kind of connect the dots is that the Health Authority Board, which is separate and independent, is appointed by the mayor. So when Mayor Webb created this authority, it was really to get Denver General at the time, now Denver Health, out from under the city personnel and procurement policies that were really hamstringing the hospital. The hospital, from that time when Webb did that action, up until, you know, with Patty Gabeau in charge, really excelled and grew. The University of Colorado sends their doctors to Denver Health to help treat the indigent. It's a really wonderful facility that in the last 4 years has gone severely downhill, again, because of these decisions to de-emphasize cleanliness, de-emphasize patient care, and really alienate the staff, who are, of course, the lifeblood of the hospital. The reason that this, again, comes back to the mayor is because he controls the Health Authority Board, and he gave no public signal and is yet to even comment on this, which is lamentable, to say the least. So, you know, it's a big, complicated mess. This is squarely at the feet of the mayor. And there's going to be a lot of work to do to clean it up. Just because Gonzalez is now on the way out very slowly does not mean that the picture has really improved. They've been able to retain some of the neurosurgeons. The nurses are staying there, but these issues with cleanliness, with patient focus, are still real. There are massive problems with their IT infrastructure, where Gonzalez has made huge investments and has had to cut medical staff to add technical staff, which makes not a lot of sense for a hospital. You know, it's a huge problem. And I'll wrap up by saying this: Denver Health is critically important for the health of Denver and the metro area because they treat indigent people and because they are funded to do so. They're a level 1 trauma center, and if we lose that, Denver is going to suffer badly, because it's likely in that scenario that the University of Colorado Hospital would then take that level 1 trauma certification, but they will not treat the indigent. And so if Denver Health loses its status, the indigent people in Denver have nowhere to go. And you can make all the arguments that you want about public support for people, but in this country, we are supposed to have a social safety net for people. And it is another huge black mark on this administration that they're letting this happen.
Let's keep the arguments rolling. Alex, as you look at the situation, what needs to be improved the most?
Well, going off of what was said, if patient care and cleanliness are some of the major components that have been neglected under his watch, I can't help but think about what's happening to folks who are demanding, requesting, and in need of care in the city jail. Some of the major complaints that we've seen recently have to do with medical maltreatment or neglect altogether. And when we see the resignation of somebody who's supposed to be in charge of this entire medical facility. Like was said, this is a #1 trauma unit, supposed to be able to deal with injuries to a degree that other hospitals may not have the capacity to deal with. I think that is not only devastating for the Denver community, but it's a loss for folks inside who may not have the ability to outsource other forms of medical treatment. So altogether, I think that, like what was said, this is a huge blemish for Denver and another jab at the Mayor Hancock administration.
Patty, so a lot of this, I think, kind of slipped under the general radar. While it was major issues at the hospital, once the retirement announcement came out, then folks started to look into it. What needs to be the next step?
Actually, the Post did some very good stories on this. Under Patty Gabeau, and even before Patty Gabeau, Denver General and then Denver Health had a national reputation. Doctors chose to come to Denver Health because of its amazing trauma reputation. It had the reputation as the knife and gun club. It could handle anything that was coming in on Saturday night. High-level doctors chose to come here, and I think they are leaving only reluctantly because they need to change the system. Patty Gabeau was an inspirational leader. I'm not sure she was great on the financial end, so I would have argued you needed someone like Patty Gabeau to come in again, and then maybe bring another person in who could do the operations, who could do the financing, who could help the doctors with the paperwork so they could treat patients rather than treat paperwork. And I think that's one of the problems that's come up here. I think we can salvage it, we can cure the problem, and Denver will.
David, wrap it up for us.
Mayor Hancock won his first term, the only one where he had a contested election, by beating Chris Romer, in part because the voters ultimately decided that he was a much more likable personality than Chris. But likability isn't everything for a chief executive. A chief executive needs to be able to make good appointments and have good personnel judgment, and this seems to be a continuing problem in the Hancock administration. The mayor seems like a very nice guy, a good image for the city in a lot of ways in his personal demeanor, but his appointments it seems like one problem after another.